From 6 News Studios, 10 minutes of non-stop news. Your hour-by-hour forecast. This is 6 News, live at 5.
Coming up later in our Pregnancy 101 report, a medical condition that is only diagnosed during pregnancy that can put a mom and baby at risk. And this is Channel 6 News, live at 5. All right, thanks, Jim. Well, after the break, it's our Pregnancy 101 report. It's a medical condition that is only diagnosed during pregnancy. The test for gestational diabetes is coming up. This is Channel 6 News, live at 5.
Channel 6 News, live at 5, continues with today's family.
There's a medical condition that's only diagnosed during pregnancy. It's called gestational diabetes, and it occurs when glucose levels are high in expectant moms. In today's Pregnancy 101 report, Cerise Cole tells us how this can change a pregnancy and put mom and baby at risk.
After 2 healthy pregnancies, Kristin Patera is forced to do things a little differently the 3rd time around.
I check a fasting blood sugar in the morning.
She does it again after breakfast, lunch, and dinner.
I did notice there were a couple above 120.
Dr. Tifany Somer-Shely monitors Kristin's numbers. She says the scary part is there are no warning signs.
You could walk around with blood sugars that are high enough to cause problems for the baby and not necessarily know it.
Most women are screened in their 2nd trimester by drinking this glucola test. A positive result means more risks for mom and baby, including having a larger baby.
And with that come complications, so higher risk of cesarean delivery, higher rates of jaundice. And later in life, kids who are born to moms who have uncontrolled blood sugars actually have a lot higher risk of childhood obesity and getting diabetic themselves.
Women diagnosed with gestational diabetes often have to cut back in foods high in sugars like pop and pie. They also have to remember eating for 2 doesn't mean eating twice the carbs.
So it has 61 grams of carbs. This is an entire meal in 1 bottle of juice.
Kristin has changed her diet. She also knows she's now at risk of becoming a diabetic, but she's more concerned about her baby.
My fear is ending up with a baby in, like in the NICU because it can't regulate its own blood sugar.
I think you've got a good 8-pounder.
Some good news as Kristin hopes for a healthy and happy baby. With photographer Mike Plews, I'm Cerise Cole, Channel 6 News.
Now, women at risk for gestational diabetes are overweight, have a family history of diabetes, and are older than 25. If you're thinking about getting pregnant, Dr. Somer-Shely says that there are ways you can reduce your risk. Just go to momseveryday.com, click on this story in Cerise's health report, and you can find out how. Well, maybe a while.